dentist transition. Right now we're here with Dr. Jeff Widmeyer joining us live in studio. Dr. Widmeyer, what's going on? How are you?
Good morning, or good afternoon, I guess it is now, isn't it?
You're used to being
here in the morning,
That's,
yeah.
Absolutely. What's the good word?
Nothing much.
Legs.
Getting ready for, what's that?
Legs.
Legs is a good word, yeah. Yeah, this is a good time of year for people to get their varicose veins fixed if they've been suffering with them all summer and struggling with them. This is a great time of year to get them fixed and have them ready for next spring.
We were laughing earlier about your phone number.
Yeah.
847
legs.
Right. And we're just like, wow. You first hear that, you're like, wow, and then it's veins. I got
right.
you. Little different deal. And JB is a big Las Vegas guy. And he's like, if we were in Vegas, that would be
it would have a totally different connotation, I'm sure. Yeah.
Does that? I mean, do you get a lot of
it's
Aaron calls?
No. So no.
Jeff, you were saying this is a time when a lot of people are starting to think about their legs and their veins.
Or maybe all summer they've been thinking about them and being embarrassed and saying, I hate even putting on shorts because, my legs, I'm self-conscious about my legs. So, all summer long they've been kind of covering them up. And this is a good time of year as weather starts to cool off to go ahead and get them squared away, get that evaluation, and get them fixed before next spring. Because every spring I always get a rush of people in March and April say, I was getting the shorts out and realized I need to get my veins fixed. And it's a little bit of a process. I don't have a magic wand yet. I'm working on it, but it is a little bit of a process to kind of get rid of the veins and have the legs all healed up and bathing suit ready, so to speak.
I've heard you on with Mary and Brian, and it's not at all what it used to be. Tell folks what a little bit about that process.
Well, it used to be a fairly involved surgical procedure. Now we have a very minimally invasive laser procedure that I was one of the first people in Virginia to even do it. But it's basically through a little needle puncture in the leg, I can thread a laser fiber inside the abnormal vein and seal it shut. And it's done in the office. It takes about 20 minutes. There's really no interruption in people's activity level. They can be up and around doing pretty much whatever they want to do. And the results are very good. And so everything for where people have such severe disease that they're developing ulcers on their legs to maybe it's just unsightly or a little uncomfortable. There's a whole spectrum of severity of disease, but I've been doing this for 20 some odd years now, and so I've seen and done it all, and have a great comfort level with anything anybody's got.
And Jeff, this is not just for women.
No, absolutely not. No, I have lots of men who come in, men of all walks of life, who some of them have a desk job. Some of them are, have a very high intensity labor job, law enforcement, you name it. But the discomfort and everything from the veins can be just a significant hindrance to getting out and doing the things that they like to do.
So it's more of I shouldn't say it's more of a discomfort than a cosmetic thing. I would imagine lots of reasons for everyone to do it, but there's a huge part of it that's a comfort factor too.
Oh yeah. I mean, yeah, there's a lot of people's veins are very uncomfortable, even painful. And like I said, even some people have ulcerations form in the leg. And it's amazing how the number of people that have these venous ulcers in the leg that have been kind of piddled with for, months and sometimes even longer. And we do the procedure and they come back for their follow-up visit and the thing's almost totally healed. I mean, they're just amazed. So yeah, it's a very effective treatment. And like I said, I've, board certified in vascular surgery and, over 20 years experience of doing this. So I put my abilities and experience up against anybody. So
what got you interested in this field?
Well, vascular surgery in general is a very precise specialty, and so I really liked the precision of vascular surgery. And a lot of vascular surgery is working on arteries, and the vein side of it was very very archaic when I came through the training and the vein stripping surgery. And so when these minimally invasive things came along, I've always loved tech and gadgets and innovation, and being able to take a a procedure that was previously very invasive and replace it with something that's very minimally invasive and really more effective even, that was right up my alley. So I gravitated immediately to that and just love doing that. And that's kind of what I've, done through my career, is looking for innovation and minimally invasive. And, even the ideal protein is, it's a very, innovative scientific, look at a common problem and being able to really offer some, just precision and expertise in those areas. It's what I gravitate to.
Yeah,
so.
It seems like an interesting combination of veins and weight loss.
Well, a lot of people who come in and have difficulty with the veins, a lot of times excess weight is contributing to some of the discomfort that they've got with other things. And wow, it just fits hand in glove with being able to help with all of that.
And next time you're in, we'll definitely dive more into the ideal protein. But I know, it's extremely effective if folks just follow the program. And you yourself, I know, did it, and now that's kind of led to, he's here, he's buff, he's just looking fantastic.
Yeah, it led me to being a lot more active and being able to do things. We were talking before, the Spartan races, were something that I started doing a number of years ago. And it's just, I'm not somebody who's good at going to the gym and exercising because it's good for me. I have to have a goal. And so it's like, oh, there's this race coming up in 6 weeks. I have to, I have to get ready, that kind of thing. And so that's why I really like doing them. I've got I should put something on our little Facebook. I've got a little display of all the Spartan medals from over the years at the office, with kind of a before and after picture of me when I was really heavy, and then after one of the races, and so that's been life-changing for me, just to feel like exercising and feel like being active, because when you're carrying around 40 extra pounds, I always give people the example. I said, think of something that weighs 40 pounds, go pick it up, now walk up and down your stairs of your house, and you'd be exhausted. You'd be like, oh my gosh, I can't wait to put this thing down. Well, that's what you're doing when you lose 40 pounds. And that's people do that all the time. They'll go to the grocery store and they'll pick up, a 20-pound bag of potatoes or whatever, and they're like, wow, 2 of these, so. Explain
to folks who don't know what a Spartan race is.
It's an obstacle course race. It was founded, this guy, Joe Cena, started it up in Killington, Vermont, which that's supposed to be the pinnacle / worst race you can ever do, because it's super steep and cold and everything else. But anyway, it's a race that comes in sort of a small, medium, and large size. They're sprint, super, and beast. And those are 5, 8, and 12 miles in length, with a commensurate increased number of obstacles in the middle. And the thing I like about them is, you asked me before, are you a big runner? I was like, I don't really like running very much, especially for a long period of time. And the nice thing about the Spartan races is most you run on, even the longer ones, is, I don't know, maybe a mile. And then you've got to carry a bucket of rocks up the hill and down, or you've got to climb a rope, or you got to climb over a wall, or you got to do a monkey bars, or there's just all sorts of different creative obstacles through it that are just very challenging and fun.
So is the race up in Killington, have you done it?
Oh, no.
Will you?
No.
It's a bucket list thing? No.
I've got lots of other things that can go in the bucket. Before that, my son and I did the race. They used to have one up in Wintergreen, which was very similar in that it's super steep. All they did was they ran us up and down the really steep ski slopes, but not even the ski slopes. The trees in the middle of the ski slopes, that's where they ran us. And I've never been more exhausted in my life. And I had a patient in the other day who has run Spartan races, and she said the same thing. She was like, that Wintergreen race was the most awful thing I've ever done. So now they moved it to Arrington. The Virginia race is up in Arrington, just, so it's like a half an hour away from here. And it's hilly, but it's very
manageable,
doable. Yeah, gotcha. It's pleasantly hilly rather than obnoxiously hilly. So, yeah, but that's what a Spartan race is. And they've got them all over the country, all over the world, actually.
Jeff, talking about your weight loss, what propelled you to get serious about that? Did you just look in the mirror one day and say, hey, I got to do something about this?
Well, I was at a surgical conference, and some other doctors were talking about this weight loss program that they offered to their patients, and they saw that they were able to help people, get their diabetes and their high blood pressure and their sleep apnea and their joint issues and their cholesterol and all these other things under control. And they made the comment that it's nice to be able to offer people the tools to lose weight rather than just telling them that they need to lose weight, because doctors are really good at telling people, you really ought to lose some weight, but we're not really good at giving people the tools to do it. And I was guilty of being a fat doctor telling people they need to lose weight. And that was sort of the revelation. I was just like, okay, that's just really hypocritical, and I like everybody else, I'm going to cut back. I'm going to do this thing. I'm going to do keto. I'm going to do Atkins, and I'd lose a little but I didn't really learn anything. And I think that's the thing that really distinguishes our program, is that we really care about teaching people how and why weight and metabolism and nutrition work, so that when they get to their healthy weight, the journey doesn't end there. And our help and our involvement and our coaching doesn't end there. We continue to help people all along that time afterwards, so that they can maintain. And so that's a long-winded answer to that question.
Do you think one of the biggest keys, because I'll say that I found this, that you need to be super committed to want to do your program, because,
yes,
it's not easy, right? I mean, it's not an easy program to do. It's, if you follow it properly, it's easy, but it's, and I mean,
it does take commitment to it. Yes. Yeah. And that's why, we had this conversation, my wife, Lori, who's sort of our head coach and is super awesome. Go Lori. But she was talking with one of our dieters who was telling us that I think it's his sister or somebody who's really overweight and really needs to lose weight. And he's like, I need you to tell her this, and I need you to tell her that. And it's like, look, I can't tell somebody anything, I'm happy to have a conversation with anybody about it, but until they have decided in their mind, all right, this is something I need to do for me. Nobody's going to be successful doing it for somebody else or because somebody's badgered them into it. They're just going to resent it. But when people finally say, and again, it may be I looked in the mirror, or, oh, I can't get my pants buckled, or I saw myself in a picture and couldn't believe how awful I looked, or I don't know, whatever it is, or I can't get on an airplane without a seatbelt extender. One guy, it was this life-changing moment. He was finally able to ride the roller coaster with his kids. He could never get on the roller coaster because they said, you're too big. You can't get on a roller coaster. And those sorts of, so everybody's got a different story for what is their motivation for it. And for me, it was just, like I said, it was just sort of the recognition of my hypocrisy of telling patients that they needed to lose weight while I was sitting there, clearly, overweight. And so. But
there really needs to be that aha moment. And for folks who have that, you have meetings every Tuesday.
Every Tuesday at 5:30. Yep, right at the office on Timberlake Road, and it was great. This past week, a guy who was one of my vein patients, I fixed his legs, and he had known about it, and we had talked about it, but his best friend, they just said, "Listen, we got to do this," and so they came and they started today. So I'm really excited for him. And he was a patient of mine. He's known about this for 5 years, and finally he just said, "Okay,
now's the time.
Let's do it." Yeah.
That music means that we're out of time.
Okay.
Thank you.
Thank you,
all right.
Jeff.
That's great seeing you guys.
Good seeing you.
Do it again next month.
All right. Thanks.
Right on.
Bye.
Jeff Widmeyer joining us here live in studio once again, 847-LEGS.
Can't forget that number. You love that phone number, don't you?
It's now drilled right into my skull. 847-LEGS. Dr. Jeff Widmeyer. We're coming back.
All right. Thanks.